The piriformis muscle is one of the muscles that can contribute to low back pain. It can also contribute to sciatica, which is that shooting pain that you might feel up and down your leg or in your butt area. So the piriformis is one of your deep rotators, meaning it helps to rotate the legs open. It also helps to lift the leg open in a rotated position. It also acts on the pelvis when the legs are fixed, meaning like if you're standing and you tuck your pelvis under, like curl your tailbone under and compress the lower part of your spine, your piriformis can actually get locked in a tight position. So where is the piriformis? It starts on the sacrum. Just turn around so I can show you. It starts on the sacrum and it goes out on a diagonal and inserts on the greater trochanter of the femur. So that's this knobby like protrusion on your thigh bone. So again, piriformis is meant to help with rotation of the thigh and lifting and rotation of the leg. However, it can get locked in a tight position, and this happens for many reasons. If you have an imbalance in your pelvis, one of your hips might hike, causing the piriformis on the other side to get locked in that tight position, or if you tuck your pelvis under, both sides can get tight. So you can either feel this on one side or both sides. Now, if you do your glute work, if you're doing any glute exercises and your pelvis is tucked under, you run the risk of overusing the piriformis and making it tight. Also, if you're doing side legs or even abdominal work and you're tucking and compressing your pelvis, you run the risk of shortening and tightening this muscle. And once that happens, it gets locked in that position, you might feel back pain, you might create an imbalance in your pelvis if it's not already there and the cause of it, or you might experience sciatica. So you really want to make sure that you've got a healthy functioning piriformis muscle in all of your exercises. Now, the figure 4 stretch, right, where you cross one ankle over the opposite knee, pull both knees in, that's a great way to test it. So if you want to go into that stretch, you can do that in a seated position. Just make sure you're in neutral spine, cross one leg over, see how it feels on both sides. If one side feels tighter than the other, then you know you've got an issue on one side. If they both feel really tight, stretch it out. Yeah, you can also do that lying on your back in neutral spine. The other thing you want to make sure is that whenever you're doing abdominal work, whenever you're doing glute work, especially in the standing position when it comes to squats, lunges, stuff like that, you want to make sure you're in a neutral pelvic position and a neutral spine. Okay, so as always, I'm around for any questions. If you want to reach out to me, info@julieturnermovement.com. Send me a private message on my Instagram page or follow me on YouTube for more videos like this.